very often we have medical professionals on the show because of our interest in making sure that we're kind of diverse, if you please, in the kind of information that we present. So we've had doctors and experts and professionals and certified people to talk about a lot of different things. And sometimes these topics or these subjects are about things that will improve your health or make you live longer or something like that. And then other times we talk about things that are absolutely essential to living, like your breath, like breathing. So today we're going to have a discussion with Rodney Cooper, who's a registered respiratory therapist. Is that correct, sir?
That's correct. That is correct.
And we're going to talk about COPD and we're going to talk about breathing and its importance and how we can try to live a life that and get engaged in activities that will help us to keep breathing, which is essential to life. How you doing, man?
I'm very well, thank you. Glad to be on.
We're glad to have you, and I'm glad to have this discussion because oftentimes we hear people talk about COPD and asthma and other things that may hinder the free flow of air in one's lungs. So I think it's important that to the extent possible that we impart information to the public because we are very interested in making sure that this show is beneficial and productive and meaningful. That's why we call it a call to action, and that this show has a positive impact on the listeners and the viewers. But first of all, tell us a little bit about yourself.
My name's Rodney Cooper. I am a registered respiratory therapist. I a graduate of the Medical College of Georgia back in 1985. Currently, I'm the Assistant Vice President of Respiratory Care Services for the Navicent Health hospitals in this area. I've been here at the Medical Center Navicent Health for about 34 years now.
Since you were about 4 or 5.
I appreciate that. But it's been an honor and a privilege to be in this profession and to be here today once again to talk about COPD as what it's called chronic obstructive pulmonary disease, because it is something that is it's a progressive lung disease, and it's today to be able to share some things that's with the disease and how we can help better manage the disease. It's a pleasure to be here and talk to you about that. As we talk about COPD, one of the things you first need to know, COPD affects about 24 million people, 24 million. It's the third leading cause of death, of disease.
It can kill you?
Yes, in the United States, yes.
Wow.
And a lot of the people don't realize that, but it can. It's the third leading cause of deaths of diseases in the United States.
Let me interrupt.
Mm-hmm.
I had a friend, that was a tennis player.
Mm-hmm.
And, he played tennis for several years. But then later on, I noticed that he could play, one game and then he'd have to sit down. And then it was obvious that he was having trouble breathing. And he died.
Yeah.
Now, is that kind of relevant of what he may have had?
It very well could be. There's different stages of COPD. You can have, there's like 4 stages, what we call. You can have mild COPD, then there's moderate, then there's severe, and then there's very severe. So those are the stages, and as you progress, with your COPD, and whether it was from smoking or other external, you can be working, not just smoking, but you can be around secondhand smoke.
Wow.
And that's what a lot of people don't realize. Secondhand smoke can be just as bad as smoking sometimes. There's other chemicals that can cause you to damage your lung that develop into, can be a development to COPD. But when we look at COPD, it's two progressive lung disease that characterizes COPD. It's chronic bronchitis or bronchitis, and then it's what we call emphysema. And emphysema, so the bronchitis attacks your bronchioles, your lung tubes. Okay, it's called bronchioles. And then we have what we call emphysema that attacks the actual alveoli, the little small, down in your lungs, the little small sacs. So when you look at the flow, because chronic obstructive pulmonary disease, it's what it is. You do not have the capability, your flow is being, and your airways are being obstructed now. It can be due to a lot of secretions and mucus, infections in the airways. So when we talk about COPD, yeah, it can lead to death. And we have seen what we call COPD exacerbations, where you come into the hospital because of your COPD, you're not doing really well, you haven't done the things you should have done, and yes, you can die from it.
Wow. So, what are the actions or the behavior, and you kind of touched on it, that contribute to COPD? Now, can it be just, I know, is it all behavioral based?
Well, with COPD, it's a preventable disease. Once you get COPD, there's no cure for COPD. Okay, once you get the lung disease, there's not a cure for it. We can treat it, but there's not a cure for it. So there's a lot of different medications and things that we can do, and we'll talk about that. But once you have actually COPD, there's not you cannot cure it. We can treat it, give medication and various things. Also, smoking is one of the biggest causes of it, clearly. I tell patients all the time, anytime you can stop smoking is good, but the damage has already been done. But anytime you can stop, it's always very good. Again, I'll go back to the secondhand smoke. We've had patients who have never smoked but wind up having COPD, but they lived in a home that there was constant smoking all the time, and they were around it. So you can, so that's how you see a lot of times when people say, I never smoke, how do I have this? But it can be. You can get it from secondhand smoking too. As far as the treatment for it, yes, there's medications that you can give to help with it. Remember, your lungs are inflamed, you have a lot of mucus and so forth. The symptoms are coughing, chronic mucus production. We have what we call wheezing in the lungs, where you can walk from here to there and you're out of breath, you're wheezing. They have little to no reserve. These are the latter stages a lot of times, not the mild, but usually when you get into severe and very severe, those are when you're seeing patients on oxygen, breathing treatments all the time. So those are the various 4 stages. But the key to COPD is really to stop smoking, stop being around that environment where smoking is. We've seen even a lot of literature says that, again, you can't cure it, but you can treat it. And that's what we do in the medical profession. When you have diagnosed with COPD, there's no cure for it, but we're treating it.
Now, in treating it, is it possible that you can properly treat it, you can live with it for a long time?
Yeah, you can, yes. If you, number one, stop smoking. Okay? Easier said than done, but stop smoking.
I understand.
Yeah. And then the other thing is, when your physician has your management planned, then you need to make sure that you're following that. You're taking your breathing treatments. Inhalers, you're using your inhalers. You're using your oxygen. A lot of these patients require oxygen. So there's a plan that your physician has dictated for you that you really should follow. Follow up with your physicians. A lot of these patients require pulmonary function testing to see their lung capacity, to see what it's like, so that the physician can direct their plan of action for them for their care.
Okay, so yes. Now talk a little bit about that test. Okay. Because is it possible to have, although you kind of talked about the symptoms, is it possible to kind of have it, maybe the early stages of it, and not know it? Or?
Absolutely, and that's what we call the mild. Yeah, you've been smoking and everything else. As far as you don't have all the really known symptoms where you're wheezing or short of breath or anything like that, you just have mild. So yes, you can very well have COPD and not know it, and we characterize that as the first stage of mild. That's why it's important at that point in time when you're not feeling quite as well, just to do some follow-up checks with your physician. They may refer, they're seeing some things, they may refer you at what we say and do a pulmonary function testing to see the lung capacity of your lungs, and that can further help them diagnose as far as what's going on, especially if you've got a history of smoking.
Right. Now, what about specialists? What isn't that a medical specialty as it relates to? I've heard of Dr. Morena. I don't know what he does, but they talk about
Yes.
him. It's been a long doctor, and I'm sure there are others. I'm not.
Yes, there is. If you've truly been diagnosed with COPD, you do need to be followed by a pulmonologist.
Pulmonologist
Yes,
is the word.
yes.
Now, there's several in town?
Yes, they are. Yes,
Okay.
they are, and they're more specialized. They, as far as in the lung management, they do other things general, but when you're dealing with the pulmonologist, they're truly specialized in that chronic obstructive pulmonary disease in the lungs and so forth. So you do need, all COPD patients should have a pulmonologist.
So they call it chronic,
Mm-hmm.
but it's not necessarily chronic in the early stages. Well, is it chronic once you have a problem with your lungs?
Yeah, we classify it as chronic obstructive because it is a chronic progressive disease. Even in the mild stage, because usually when you get to the mild stage of COPD, you've been smoking for a while still. You still could be young, because what we're seeing, we have young people start in teenage and smoking. And
Let me interrupt you quickly. What about the what you call vaping? Now,
Yes.
I mean, I knew that, and you may not know. I know that it's early on, and there's a lot of controversy because some people think that vaping is an improvement over smoking, that it's less harmful or dangerous.
Yeah, and I've heard that, and I've looked into that somewhat and read up on it somewhat, but when you're still bringing in those toxins into your lungs, yes, it still is not helpful. It's more harmful to the lungs still.
Okay.
Yeah.
I'm sorry for interrupting.
No, that's a good question. Good question.
But I thought about that. Okay, so now let's say again, what are the indicators, and distinguish again between emphysema and bronchitis.
Yes.
And also talk about, I want you to kind of distinguish it, because if in fact you coughing or you got a cold, I mean, when should one be concerned, and how does one know he got emphysema or bronchitis?
Well, again, the bronchitis is more sputum production. It affects more. The bronchitis affects more of what we call the larger airways, your bronchial tubes. Okay, so you have a inflammation that really attacks your bronchial tubes. You have inflammation, swelling. And remember, chronic obstructive pulmonary disease, COPD, your airflow has been obstructed. That's why it's called chronic obstructive pulmonary disease. Your airflow is obstructed. The obstruction is caused by, when we're talking about chronic bronchitis, your bronchioles, your air tubes, they're inflamed. Could be mucus in there, just inflammation.
And then they're tight, they're
right.
constricted.
Normally, very good. Normally your airway may be like this, but with COPD patients, chronic obstructive, it could be like that. It's like breathing through a straw.
Wow.
Okay. So that's what the chronic bronchitis and the mucus production. Emphysema is more as at the end of the bronchial tubes themselves, they're little sacs. That's where your gas exchange and everything takes place. That has been damaged with emphysema. Those sacs are damaged now and so forth, so you don't get because of the disease process, your oxygen and air exchange and everything has been damaged in their air sacs, because that's where and the alveoli, that's where the gas exchange takes place.
Wow.
So emphysema has damaged your air sacs. Bronchitis, you have more damage of your larger airways.
And the tube.
Yes.
Okay, now how are they related to asthma? I mean, is there a distinction between asthma, bronchitis, and emphysema?
Well,
are they related or what?
Well, the thing
This is a call to action.
A call to action.
I'm your host, Alex Havishell. We got so into this breathing exercise until I didn't think that I thought maybe we ought to identify ourselves again and introduce Rodney Cooper, who's a registered respiratory therapist at Navicent Health. And we are having a dynamic, entertaining, and interesting conversation about breathing.
Yes.
And it's important, of course, it's essential to life. And we're just doing some discussion on COPD, which is obstruction to being able to breathe. And so it's been very good, Doc. We appreciate it, Doc, Ms. Cooper. And we want to continue the discussion about asthma and I remember where we were. I'm impressed.
Yes.
About asthma, emphysema, and bronchitis.
And when we talk about COPD, chronic bronchitis, emphysema, but then you mentioned asthma. Generally, chronic bronchitis and emphysema, smoking and so forth, but asthma, you don't necessarily have to smoke at all. Okay, it does affect the airways. It's more where the airways are inflamed. Instead of being open, they're inflammation and swelling. You can't get air in and out. So it can be it can be inherited. It can be outside environments that causes the asthma, hereditary again. So asthma is a different thing than emphysema and chronic bronchitis, because there's, smoking, you don't have, babies have asthma and so forth. So it's an infection or inflammation of the airways, which it does cause the airways to inflame, and that does cause airflow to not get in and out like it properly should. So asthma is something that is also has been really can be detrimental. Normally you shouldn't die from asthma, but you can get to where you have a real bad asthma attack and not make it to the hospital, and it very well could be life-threatening.
Wow.
Okay. Again, there's treatment management plan, correct? Getting with your physician as far as your management plan and taking breathing treatments, taking your medicines, avoiding those things that trigger attacks and so forth for asthma. But COPD is a little bit different, though. It is a little bit different.
Now, with asthma, the problem is still in the same location, right? Mm-hmm. Is it just caused by something different?
Well, asthma can actually, you may have an asthma attack when you were a small child. You can go up through,
but it's still in your lungs and in your tube.
Yes. Because you can go for years and not have an asthma attack, and then all of a sudden something that triggers it,
right,
you can have an asthma attack.
Right.
Yeah.
Right.
So there's something that still could still be there to trigger that attack. Yes.
Now, what does a respiratory therapist do?
We are very involved. A lot of people confuse us a lot of times with nurses, because we're at the bedside like the nurses. If it's two disciplines that are at the bedside together a lot, it's the respiratory therapist and the nurse. So we get confused a lot of times.
You know
with
why,
nurse.
don't you?
Why is that?
Because they gotta breathe.
Yeah, that's right.
they gotta keep breathing.
But what we do is we take care of patients with any heart or lung issues. We take care of patients who, trauma patients that come into the hospital. Any patients that's on a respirator or a ventilator, it's being managed by a respiratory therapist. We are involved in the labor and deliveries, babies, premature babies, less than a pound to bigger babies. We're there taking care of those babies that have the respiratory difficulties, that are on the ventilator. We go to C-sections. So we're really involved from the neonate, the small baby, to the geriatric patients. So we're highly involved with anything that affects the heart, lungs, trauma patients, anything affecting pulmonary wise, we're there, we're involved.
Okay. Now, do you all are you kind of like case managers? I mean, if a person, do you deal basically, in the hospital and?
Well, that's a good question because we've branched out. Respiratory therapists are involved in the hospitals in administrative roles such as myself. We're involved in the schools, of course, and teaching and so forth in the schools. But we're also involved now, have branched out into what we call case managers, COPD educators, dealing with getting patients discharged and the proper things that they need. Long-term care facilities, we're involved in that, management of those patients. So yes, we're not just the typical in the hospital, just that's all you do is out home care. So we're diversified now. We really are.
Yeah, that's pretty outstanding. So if in fact you're diagnosed with a pulmonary problem, maybe from your kind of general practitioner diagnosed, whether or not are they capable of testing you, or should you go to some other kind of specialist?
Well, there's nothing wrong with having a general practitioner, but when you get to the point where you're really diagnosed as COPD.
I mean the diagnosis, I'm just talking about the diagnostic process. Can your doctor just give you that test and say, hey, you got COPD?
Yeah, well, there's a little bit more than that. There's some more testing to do.
Oh, okay.
and actually lab testing and things like that they look at, pulmonary function testing, chest x-rays, different things, history. And then, but yeah, a general practitioner can diagnose and say, well, they're diagnosed as COPD. And generally, if that's the case, then they refer to a pulmonologist to follow you.
Yeah. Now, when you said medication, you didn't mention ingesting, like pills or capsules. Is that a part of it?
Yes, it is. There are certain medications, steroids, for example, that COPD patients, that they can take them through, use a steroid with their inhalers, but also they're prescribed a lot of times pills, steroids to help with inflammation. Because again, COPD, your lungs have been inflamed, so a lot of times they're on steroids. They can get infections in their lungs, and they're prone to pulmonary infections. So antibiotics, sometimes when they have the infections, they're on antibiotics. They're on bronchodilators, inhalers. But there's also maintenance drugs, the inhalers that they're on, but there's sometimes other remedies that the physician may put them on orally too. So yes, there's a variety of medicines that COPD patients can take to help. Once again, this is their treatment plan. It is not curing the COPD. There's not a cure for COPD. There's a treatment for it.
Okay, let's talk about what's the distinction between, and the danger, if you please, of say a dry cough, when you cough, from your lungs, and then a cough with mucus.
Right. And COPD patients can have both. They can have both. They tend to, when the mild COPD generally is the dry cough. Okay. As you get to the moderate, unless they have an infection on top of that, because you can have COPD, but guess what? You may have a pneumonia on top of that, and then you may start to produce that mucus and so forth. But if it's strictly COPD and not any other infection, you can have a dry cough. Generally, when you start producing mucus, there's some type of, a lot of times, infection going on too with it. And the physician will a lot of times put you on antibiotics and things like that, especially if you're really coughing up a lot, and the color of it, that makes it opportunity as far as if there's infection going on too.
You don't know the color there.
Oh yeah, I've seen some nasty color, green, yellow,
really?
brown. Yes.
That's coming up.
That's coming up. Yes. And those patients, when they're starting to cough up this yellow, this greenish stuff, that's a sign of infection going on. Because remember, with COPD, your lungs have been inflamed. It can be chronic bronchitis, and where you're producing a lot of mucus, and that's a source of an infection too, as you're producing this, and it's the color of it.
Now, can you have, like say, an infection, a lung infection, and then you go to the doctor and he gives you don't have it all the time.
Right.
But, under certain circumstances, you find yourself, coughing and stuff like that and bringing up stuff. Is it possible, to kind of heal that? Just that one time
Oh yeah, the
thing?
infection, yes. You can actually treat and take care of that infection. But what I'm saying is the chronic obstructive pulmonary disease, that is still there, but that infection can be treated, yes, and taken care of.
So do you think that maybe we ought to try to educate the community and everybody that that is something that it won't hurt them to try to take that? What do you call that test?
It's called a pulmonary function testing.
Take a pulmonary.
And
just for curiosity, you could take it.
Yeah. Every patient that really is a diagnosed COPD, they should at some point in time have had a pulmonary function testing. And most do. Some do not, but most do. But if they're being followed by a pulmonologist, 9 times out of 10 they've had that test. Now, if they're being followed by a general practitioner, sometimes they may not.
We're about running out of time. How can one? Is there any kind of mechanism, say, for education or information that one can learn more about COPD in your office?
Yeah, let me just say this in closing. We have a very good COPD program at Navicent Health, where we have my therapists are COPD educators, and that's what they do. They visit those that are diagnosed with COPD. They give them packets and information, go over their medication and everything. They also offer what we have a pulmonary rehab program, because that's important for all COPDers to try and build up their endurance and to help them in going through. And we do that at Navicent Health. We have someone on Monday, Wednesdays, and Fridays, a therapist that goes in and does our pulmonary rehab program. So we have been very successful in health disparities with our COPD program. And we had a big disparity way back some years where the African-American male had a significant more readmissions on those individuals than the white Caucasian males. And through this program, that disparity resolved.
Well, we certainly appreciate it, Doc. You've done a phenomenal job. And so how should one they should just call Navicent and ask for the respiratory therapy?
Yeah, they can ask for the respiratory department, and they want to find out more information about the COPD
Respiratory
program.
Department?
Yes.
Okay.
And they want to find out more about the COPD.
This is a call to action.
A call to action.
I've been interviewed Mr. Rodney Cooper, a registered respiratory therapist. Thank you so much for all you did. It's been very informative. Have a great day.